And,
It's 1729.
good go. Looking for approval of the minutes of the October 17th meeting by Mr. Denisha, seconded by Ms. Curran. Any discussion? All in favor?
Aye.
Opposed? Carried. Approval of the, three vacant or three absent tonight. Terminally Haggard and Fiacco all have employment related issues to deal with. They've been excused. So we don't deal with it. Move right now to the agenda. The first item is weights and measures with Adam Simmons. I forgot to approve the minutes. For a motion to approve the October 17th minutes. I did it. No, I'm sorry. Ms. Curran and Mr. Kirk. Need discussion. Being none, all in favor?
Aye.
Opposed? Carried. Now we have that. And the resolution is modifying the 2022 budget for weights and measures for increased fuel costs. Moved by Ms. Curran, seconded by Mr. Perkins. Go ahead. Alex.
Thank you, sir. So this resolution is in response to our projection that we're gonna go over our fuel budget and our near state quality sampling. Starting on, I believe. Okay, there we go. Sorry about that. So like I was saying, we're projecting to exceed our budget for fuel and the petroleum quality sampling program as well for 2022. We're also projected to have excess in our revenue for permits for the year 2022. So this is a resolution asking to move some of that money from our revenue from permits from the item pricing law over to cover those overages to gasoline.
Any questions, discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Thank you. The next comes from Community Services and Jay Ulrich. Modifying the 2022 budget for Community Services for medical malpractice insurance coverage through Allied World Surplus Lines Insurance. Moved by Mr. Burke, seconded by Mr. Smithers. Jay, are you with us? Jay, are you with us?
I am.
All right. We're looking at the first resolution modifying the 2022 budget for community service. It's been moved and seconded, and now we're waiting for your comments on it.
Okay, so this is for medical malpractice insurance specific to the opioid treatment program. So we got this quote probably towards the end of October. Didn't have it in the 2022 budget or the 23 budget. So we, for this year, are planning to, or asking to use the DSRIP monies that we accumulated several years back when we were doing the 3AI project with NCI. So we have that in deferred revenue account, and we wanted to use that to offset the cost of the medical malpractice insurance for the OTP.
Any question, discussion, Ms. Berger?
Jay, is this for the jail MAT or is this for the methadone?
This is for the OTP for the methadone and Suboxone daily dispensing. So it'd be for the PRU, they call that, for Oasis, which is the OTP. That's my understanding.
And your regular, and your regular medical malpractice insurance doesn't cover dispensing MAT or methadone?
No, this was above and beyond. I think just the fact that we opened up a new clinic site would have increased the cost. And I think because this is a specialty service, that even made it more expensive.
Okay, Mr. Perkins?
So this goes through March. So, and then from moving forward, I think the calendar year will be about $35,000, $36,000.
Jay, was there an RFP done for this?
That I don't know. I think this was done through the county attorney's office.
I believe they utilize the same provider that they have for the other departments, so the jail, public health, and community services, for the mental health and addictions clinic.
Thank you. Mr. Akers?
My question was the length of the term. So Jay said that it was only take us to March. So that's what I want to know.
No. Seeing none, all in favor? Aye. Opposed? Carried. The next resolution, Jay, is authorizing the chair to sign a contract with Hikma Pharmaceuticals USA Incorporated for the purchase of medications for the opioid treatment program and community service. Moved by Ms. Curran, seconded by Mr. Akers. Jay?
All right, so we had previously had agreements with Cardinal and McKesson to purchase the OTP medications, predominantly Suboxone and Methadone, but there's, Subutex and, Vivitrol and other ones that we also use throughout addiction services. And Hikma, we did a bid, and Hikma came under anywhere from 30 to 50% less expensive than those we were previously using. So this is a resolution to lock in the prices for what they gave us for the year, rather than just leave it an open-ended PO, and then if the price goes up, then we got to pay more. So this contract is for locking prices.
Go ahead, Mr. Akers.
Jay, I'm just curious, what's a dose of Suboxone individually cost and a dose of methadone?
Oh, I don't have that off the top of my head. I think methadone is like $8 a dose, whereas Suboxone, it was, I think, like 30. I'm not sure what the new price point is now, but methadone is relatively inexpensive compared to Suboxone. It's like
Are we recovering this through their insurance or Medicaid or anything like that?
Yes, yep. Through insurance.
And what would you say, what percentage? Some don't have any type of coverage at all, or if they don't, do you sign them up for Medicaid?
Yeah, I think we're using our peers to get everyone that's getting MAT, whether it's through the OTP or through regular clinics. So, we were at 100% enrolled in Medicaid, and I'm assuming if we're not there, we're right close to that. We try to run right around 100% and have the peers work with those individuals to make sure that they have Medicaid or Medicaid managed care.
Good. Thank you, Jay.
Mr. Reagan?
Jay, how many people are in the methadone program now?
As of Friday, there was 103. I don't know if we have any new admits today or not. I did not ask.
How would you say it's going?
Well, we didn't anticipate this many individuals at this point. I think we had predicted to the end of the year, I think maybe 30 participants, and we met that within the first month. So in terms of the need, there certainly seems to be a need in the community because we're already at 100. And originally, when we first opened the OTP, we had a cap of 100 people, and we had since petitioned or got a waiver, so to speak, from Oasis, so that we weren't bound by that 100 participant limit.
How would you say the program's going?
I mean, the program's going well. I mean, there's always a few hiccups when you're moving that many people through, through the clinic and the building. But overall, I think it's gone fairly smoothly.
Back when we were discussing doing this program, Credo had told us that during their first year, they had a lot of problems and had pretty much an entire staff turnover because of all the problems that they had. I just want to tell you, please pass this on to your staff, that you guys are doing a great job, especially in light of such a huge increase above what you originally were planning for, and the fact that you're handling it. There's going to be hiccups, there's going to be problems. There's probably going to be more serious problems down the road, but you guys have done a tremendous job, and I just want to tell you that we appreciate all that you've been put through in getting this up and running, and the fact that it's running and serving, getting out there and providing services to people who otherwise, might be showing up for autopsies is important to the people of the county. So I just want you to know that we appreciate what you're doing.
All right. Thank you very much. I mean, I will say overdoses have almost doubled from last year. Well, almost doubled from 2021. So, I mean, there's still quite a bit of use going on within the parameters of the county. But thank you.
Mr. Akers.
Jay, how many of these individuals have transferred or moved on from Suboxone to methadone? And if so, would that be considered a success?
Well, methadone, individuals that are on methadone are typically the highest need. So for, their clinical presentation, it's a better medication, to help them hopefully not become involved in other street drugs and or just life instability. It has a stabilizing effect for the high needs individuals. So I don't know the exact number of people that were switched up to methadone, but I can get that information.
Oh, it's important. I don't have to have the information. I just wanted a sense of actually who these people were, if they're coming straight off the street, seeking out. You mentioned that it was kind of a peer thing, so there must be some recommendations from users that are telling other substance abuse users that, hey, here's an opportunity and it's stable. We don't have to get it off the street, endanger ourselves with fentanyl or things of that nature. That's just curious about that. If you had any comments about that.
Well, again, I mean, we weren't anticipating this. I mean, 55 of these individuals are new to clinic, which we also didn't really anticipate that many this readily in terms of the time frame that we've been open. And some of those have been, literally quote unquote off the street, and then some of them have come from other providers. I don't have that particular breakdown either, but it's a mixture of both. Out of that 55 that are actually new to our county services, I don't have the breakdown between how many were just initiating their treatment for the first time versus transferring in from another facility.
Thank you, Jay.
Mr. Burke.
Jay, I know it's early in the program as far as having any data on people who reuse substances, but will that be something that you'd be reporting on as time progresses? And again, a couple of other small questions. Do we do counseling in addition to the administration of methadone?
Yeah, I mean, we offer the counseling and group services and peer services for everybody in the OTP. Unlike the MAT mandate in the jail, I think they are more required to participate in these ancillary service or support services in addition to medication management. In the OTP, we would still continue to prescribe either Suboxone or methadone, even if they choose not to participate in counseling. So, I mean, but we strongly encourage and we urge them, and we have, our certified peers, to also support them to continue with the counseling and group process along with the medication.
Is there routine testing with the methadone drug testing for other substances, Jay?
Yes.
Thank you.
More so than in the addictions clinic, because we have more availability to test them. Particularly during COVID, when we were doing a lot of telehealth, some of these individuals wouldn't come to the clinics for months at a time. So it was more difficult to test. The individuals that are showing up either daily or every 2 days or once a week for dosing, we have more access and more oversight, I guess you would say, with regards to testing.
Anyone else who hasn't spoken? Go ahead, Mr. Andrews.
I think one of the things that we expected to see was that as some of these people who were involved in heroin or involved in fentanyl and such, as they, moved on to methadone, that a certain number would be tempted to also do both. And that's a very, very dangerous combination. And, it's terrible to think of, people overdosing. But I think in the long term, the methadone can help stabilize some of these people and help them put their lives back together. But some of the people who choose to take the methadone and also continue mixing it with street drugs, are treading a really dangerous path. And, the overdose problem, is going to be one of the byproducts of that. But I think that having this methadone program will provide an important tool for the addiction treatment people to help, people who want to make the effort to try to get their lives back on track. So, but, obviously, long term, we'll be looking at, what's going on with the overdoses and seeing how things are measuring up.
Anyone else? Seeing none, all in favor of the resolution?
Aye.
Opposed? Carried. Thank you very much, Jay.
All right, thank you.
Next will be Ms. Jolene Munger from Public Health. And the first resolution is authorizing the chair to sign contracts for early intervention services for the Public Health Department and setting 2023 rates for early intervention services. Moved by Mr. Denisha, seconded by Mr. Smithers and Mr. Burke. Ms. Munger.
So this resolution is for setting our rates for our early intervention program for next year. There are two different sets of rates for our current providers and new rates, new providers that was put into place in 2019. I was looking for when we set the rates for our current one is they've been that way since at least 2013. So that's for that. So any new providers that we were to hire going forward will be paid the new rates, which is comparable to other early intervention provider agencies within the county.
Mr. Schmidt.
Jolene, later, we have a resolution that talks about the need for a restructuring of the rates that came from the NISAC convention. Want to comment on that now, or should we wait till later? It talks about need for a change in the rate structure because it's a flat rate, and so there's an inequality of availability.
Why don't we wait till we get to that resolution? Okay,
Okay. Maybe it'd be
well, we
connected.
can confine ourselves to this resolution, and then you can reference back to it if you wish.
Okay.
When we get to it, rather than confuse the issue. It's confusing me. Anybody else? Mr. Akers.
Julian, this is per half hour, correct? Is it half hour or hour rate?
It depends on what the service that's being provided is for. So it's whatever, some of them are, I think, an hour long, just depending on what it is.
The travel reimbursement that I see that goes to 0.
Well, it was at 0. It goes up to 45 cents per mile for anybody that new. So providers that started before, they don't get reimbursed their mileage, but the new ones will get reimbursed.
So then the travel reimbursement is for meals or something?
So the travel. I'm not sure what the difference is, to be honest. The travel reimbursement is for the providers to actually get to the site, but it doesn't go from their, it's something to do with it being the services. I can find out for you.
It's probably not a big number.
It's not, so, I mean, we don't have a lot of early intervention providers. There is an early intervention provider shortage. We'll get into the resolution a little bit later. We haven't had a new provider start with us since at least before 2013. We are trying to recruit providers, but we have not had any other contract.
Mr. Ray.
Doing the rate for new providers in several categories is less than the rate for current providers. If we're having trouble recruiting providers, why the cut in the rate to new providers?
So my understanding is when they changed this back in 2019, is that it was based off of discussions with other early intervention providers in the county to be consistent across the board. So a person, and an individual may not be contracting with us, but they might be employed full-time by another provider. That agency then contracts directly with us. So it's county contracted versus agency contracted. So I can go back and look into why, but that was, the rates were set back in 2019.
The rate for new providers, is that set by the insurance providers as far as what they'll pay?
That was set by the previous director.
Because it would seem in the past, the rates would be done to, taking into account what the insurance providers are willing to pay, as well as what it takes in order to recruit providers. I didn't know that we could just set rates, without regard to those things.
So I would have to look into that. I just know that they were set previously and we have not had a cause to change them since 2019.
Then what's the cause to change them now?
This is not change. It's just setting the rates again. Every year we go through to set the rates. They were, the last time that they were changed was in 2019. So these are the same rates that they were last year that was passed. No, for both. Yeah, so current providers are people that were hired prior to December 31st, 2019. The new rates would have been for anybody hired since December, so 2020 on. I'd have to go back and get some information as to why it was thought to change them in 2019. But I know that there was something that came.
Yeah, I mean, you know, if you could just look into it, it just seems. I didn't think that we could arbitrarily make those changes,
So what,
and, you know, that our goal is to get as much of the insurance company, you know, to cover the costs as possible, and also to make us an attractive provider for, you know, when we're trying to get occupational therapists or others to take some, you know, cases. But thank you.
Is this something you want her to look into further and get back to you about?
You can just talk to Ruth. Shouldn't have to get back to me.
Anyone else? Ms. Kerr?
So when we look at these rates, the $175 for the developmental core evaluation for somebody that worked for us prior to December 31st, 2019. Is it the same length of time that's billable as the person who's $155 per visit? Is there anything different about the two visits?
no, there's nothing different between the two types of visits.
Thank you.
Mr. Burke?
Jolene, is there any direct subsidy from the state, or is reimbursement from insurance companies?
So there is some reimbursement from insurance companies, and some of the services for what we don't get reimbursed does fall under our state aids. We can get reimbursed that way for a portion of it.
Just wondering whether it's whether it's a good idea to jack the rates up, and how much is coming out of local taxpayer dollars.
So some of it is that the rates that the state does reimburse are lowered, and that goes to, I believe that goes to the resolution. I'd have to reread the resolution from NISAC. I was there, I just don't remember the wording of what it is that they're trying to do with that one. But there is only a limited reimbursement that you do get from the insurance companies.
What else? Seeing none, all in favor of the resolution? Any opposed? Carried. And Julian, you're going to tell us about the funds at the farms. My what?
Resolution for the pharmacy service.
Oh, for Seacon, I'm sorry. Pardon me. Have a resolution authorizing the chair to sign a contract with Danny Seacon for pharmacist services for the public health department. Moved by Ms. Stern, seconded by Mr. Smith. Go ahead.
As part of our Article 28 requirements, we have to contract with a pharmacist to do twice a year reviews. If they find a deficiency, they'll come back the next quarter to ensure that we've done address the deficiency. So we are looking to contract again with Dr. Danny Seacon for the next 3 years to do it could be up to quarterly audits, but at least twice a year.
Questions? Mr. Perkins?
Thank you, Mr. Chairman. Jolene, do you know how many hours roughly it takes for him to review the policies and procedures?
He hasn't done any yet that he's billed for. It's just been through, just depends on if we are changing our policy, so maybe 30 minutes to an hour. So it just depends on where we're at. If we're putting a new policy into place, if we get something new, it might take a little bit longer for him. But I don't think he charges for the last few hours that he did, just coming on board new last year.
Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. Now,
For the last couple of years, we have done some COVID clinics with our farms in cooperation with Cornell Cooperative Extension, and this was mentioned, I believe, at the last services meeting. But this year we expanded a little bit, and we did 9 farms this year, but instead of just doing COVID, we expanded it out to other vaccination that farm workers might require. So on those 9 farms, we did 74 Pfizer boosters, 12 new J&J for COVID, 89 flu, 60 Tdap, and 6 hepatitis B. So we still have 1 to 2 farms to go out and do that. We're working with Cornell to coordinate with. One farm missed the deadline, so they weren't included in our numbers, and another one, the farmer had to be away. So we're trying to get a couple more in. And then next year, we're looking to build on the program even more to expand offerings, eligibility. We learned a lot doing that first time to this year. So to go from offering just one type of vaccine to multiple types of vaccines, and it's different with if you have insurance versus non-insured. So we learned a little bit more, and then next year I think we'll be able to expand it out further and get even more of the farm workers vaccinated for whatever vaccines that we might be able to take out.
Mr. Akers.
Jolene, thank you very much. I can't tell you how grateful the farmers are. Many of the operations today are operating 24 hours a day, 7 days a week. So those that are working the night shift, they're sleeping when you're open during the day, or if you work the day shift, you can't get a shot. So, and then you can do it, many of these farms have anywhere from 20 to, I know one farm has 100 employees during the crop season. And I think it's kind of overlooked as far as the business, a little bit of a tangent. They used to have this list of these new companies that came on, and this one's generated 7 employees. The farms are left out, anywhere from 20 to 100 employees is not that uncommon. Just figure 50 cows on a farm, it's one individual. So I want to thank you once again for implementing this program. It's been a lifesaver for these farms. Truly supportive of public health.
Mr. Ganesha.
Thanks, Mr. Lightfoot. Jolene, again, I would like to offer my thanks. I know you presented an award from Cornell. As Mr. Akers says, a great number of the farms that we have employ migrant workers. And some of the workers that are there may not have had the opportunity to receive vaccinations. Some of them were not aware that they were there. So again, that's another service that's greatly needed and greatly appreciated.
Well, then this year we expanded out to insured farm workers as well. So it's a little bit more of a challenge on our part because it's a separate vaccine. We lot numbers, and you have to keep everything in separate containers. But we are hoping to expand that part of the program as well next year too.
Anyone else? Thank you very much. Next is Commissioner Seaver with Social Services, and the first resolution is authorizing the chair to sign a memorandum of agreement with Western New York Independent Living Incorporated for the provision of the Consumer Directed Personal Assistance Program. Moved by Mr. Burke, second by Ms. Curran. Go ahead, sir.
Thank you, sir. This resolution basically is going to allow us to continue to work with New York Independent Living Incorporated. It's a group that we've worked with for some time. One of the things that we found over the last few months is that there were some agreements that should have been renewed some time ago that were not. This is something that my new medical services supervisor caught. So this resolution is just basically to reaffirm that we've been working with this group since 2020. There's no cost to the county, as this is just a funding pass-through for this organization to continue to allow people to select their own care providers for personal care.
Questions or comments? Seeing none, all in favor? Opposed? Carried. The next resolution is modifying the 2023 budget for social services for the purchase of conference room audiovisual equipment and furniture. Moved by Ms. Curran, seconded by Mr. Smith. Go ahead.
Thank you, sir. So a couple months ago, we were fortunate enough to bring on a new deputy commissioner. Mr. Hamilton is sitting here with us tonight. As part of that, we needed to renovate some office space, and in doing so, we realized we do not have an actual conference room anywhere in the building. We have a training room downstairs that is woefully inadequate for most of our meeting needs. We had the opportunity to revamp some space and create a conference room that would be suitable for meeting with people from Albany and from different organizations that want to come partner with us, as well as provide the office space needed for the deputy commissioner and clerical staff. So this resolution is for the purchase of the audiovisual equipment, so we could have the Zoom type meetings in there, the table, the chairs, some office furniture for Mr. Hamilton, as well as some waiting room furniture for both the clerical space on that part of the building or part of the office suite, and for my own waiting area outside, because it's been woefully ignored over the years. So I would request that this, motion go forward so we can purchase the stuff that we need.
Questions or comments? Seeing none, all in favor? Opposed? Carried. The next resolution is modifying the 2022 social services budget for the purchase of document scanners for use with the new legal files program. Moved by Mr. Burke, seconded by Ms. Curran and Mr. Smithers. Go ahead.
Thank you. So earlier in the year, we started using the legal files program and realized that some new scanners would need to be purchased to accommodate the software. These actually should have been purchased early in the year. For whatever reason, they were not. The funds were budgeted. We're asking to go ahead and allow this modification to go through so we can purchase the scanners to continue to be efficient with our legal documents.
Questions? Mr. Perkins.
Thank you, Mr. Chairman. How do we decrease the appropriation from Medicaid to state? There's like $9,500. How do we decrease that?
To be honest with you, sir, I would have to check with our accounting department, see that it has to do with our.
Sure.
So we received a couple of adjustments this year to our Medicaid payments to the state. We received an additional level of funding we weren't anticipating, so that makes it such that that decreases our obligation to the state. So we've actually been able to, rather than drop from contingency or fund balance, been able to reappropriate those funds because they won't be due. And of course, next year, we'll see those funds go away, and payment will go back up.
Okay, thank you.
No else. Seeing none, all in favor? Opposed? Carried. Now we will get some statistical information from social services.
Thank you, sir. I'm going to cover the three metrics that I normally discuss with you before I turn it over to Ms. Rand and Mr. Hamilton to go over the more of the meat of the statistics. So the first one you should have in your packet, again, deals with the percentage of workers with more than 15 CBS investigations. I do not have the October data yet, but as you can see from August and September, we had a dramatic turnaround that accompanied us, closing out a lot of those overdue cases that have been there. This is in many ways, a direct result of your generosity, giving us the positions that we need to be able to get the work done. So I'm very pleased and very proud of our staff for the work that they put in. Closing out all those cases has not been easy. They've certainly, put the time and the blood, sweat, and tears in to get the work done. But we are still have some work to do, and I'm hoping that the October statistics, when I receive them from the state, are going to bear that out. That we are push you down towards that state average, but we're very close to it now. Certainly ahead of a number of our peers. I may be just a little bit competitive in that department, but I want, my goal at the end is for us to be, leading the pack. But we're certainly getting there, so. If there's any questions on this particular chart, I'd be happy to answer them before I move on to the next.
Mr. Smithers,
This is commendable. We've had concerns over, as you know, over the last year in this area, so this is really good news.
Thank you, sir. So the next slide is the percentage of overdue investigations. As you can see, we're dropping down. We're not where we kind of want to be yet. I'm hopeful that the October statistics are going to show, a continued move in that direction. This is a direct result to us, getting those caseloads down. They're very much intertwined. As the overdue cases get closed, the caseloads get reduced. Our current caseload in September, the average was down to 10. We did have, and Ms. Miranda is going to speak to that, we did have an uptick in the number of cases that came in over the month of October, which brought our average caseload up, I believe, to 11, but we are still below the state recommendation. OCF, as you know, recommends 15 or below. But I think getting these overdue investigations closed was one of the key elements in the way of us getting those caseloads down. So I'm very pleased with the work that our staff have done so far in this area. And if there are any questions, I'll move on to the next. The last one, I continue to be extremely proud of our staff on percentage of timely safety assessments. We are remaining at the 99% mark. We are right up there on the top of the state where safety is concerned. Our staff are getting those assessments done, getting them done well and getting them done in a timely manner. So hats off to the CPS unit for the work that they've done in that area to make sure that they're getting out there in the community, making sure that those assessments are done as they should be.
questions or comments?
All right, thank you very much. At this point, I'd like to turn it over to Ms. Rand to continue with the statistics on our services unit, followed by Mr. Hamilton, who will discuss our eligibility side of the house.
Good evening. We're going to move through the data slightly different. I'll point out a couple of highlights from each section. And as always, if you have any questions, please feel free. Beginning with the Child Protective Services data, the greatest challenge for the month of October, as the Commissioner had mentioned, was the slight uptick in the number of reports that we received, an additional 36 referrals from September, for a total of 186 for the month of October. We also saw an additional 423 youth associated with those referrals, which was 102 more than the month of September. Just point out that the largest number of allegations received again is the parents' drug and alcohol misuse, followed by a lack of food, clothing, and shelter, and lack of medical care. A bright spot, as Commissioner mentioned, continues to be the number of safety assessments completed on time. For September, as previously noted, the agency completed 106 out of 107 for a total 99% completion rate. This means that safety was assessed, information was entered into the New York State connection system, and supervisory review and approval were completed within the 7 days from the case initiation. On page 2, a high point is that the average caseload in Child Protective Services continues to be at or below that New York State Office of Children and Family Services recommendation of 15 or fewer investigations per worker. This really allows workers to enter notes more contemporaneously, provide more intensive and supportive services approach while helping families ensure their basic needs are met, especially through what can be a very difficult holiday season for many of the families the agency works with. A barrier to closing out cases exists when the number of new referrals increases, resulting in members needing to reprioritize their time to assess the new allegations of neglect and abuse. So as a result, the agency did see an overall increase of 20 in the total number of open cases from the month of September. Also, you'll note the number of cases closed fell from 195 in September to 110 in October. As we look at the foster care and preventive data, I will note that a highlight, of course, is that we saw another reduction of the number of children in care from 260 to 259. I would say this is significant given the number of CPS referrals, child protective referrals that we received for the month being up, as those typically drive the number of youth placed in care at times. The total number of days in care remains a long-standing challenge. The average days increased by 2 days from 780 to 782. However, the number of days for youth without a resource being in care decreased from 705 to 701. As we've discussed previously, there have been very positive changes since the beginning of 2022 with the new family court judge. Timeliness to permanency for youth placed in care after January of 22 has improved. Adoptions have increased, as well as the number of direct and kinship placements. Unfortunately, it's going to take more time to see a more favorable impact on the timeliness to permanency for youth who were placed in care prior to January of 2022. As you recall, the agency started the year with 311 youth in care for the month of January. As we look at the foster care and preventive units, for many, many months, I've been telling you that we've been seeing a decline in the number of youth that we're serving in the home. I'm happy to say that in October, we saw an increase from 137 to 154. The agency hopes to be able to continue to increase the number of children and families we're serving in the home to prevent foster care placement, as opposed to working with youth once they're already placed in foster care. The challenge for the agency continues to be recruiting new foster homes. The agency has started offering MAPs, or model approach to partnerships in parenting, training, and education for prospective foster parents. The hope is to continue to add foster homes that can help keep St. Lawrence County youth within the county. This will help with continuity of community, for example, maintaining them in the same school district, maintaining their current service providers, as well as religious preference, sporting activities, those sorts of things. The agency will be able to better match the youth to the foster home with increased foster home numbers, and ultimately will improve the outcomes for our youth in care. St. Lawrence County adoption activity data for the month of October, the agency had 6 adoptions compared with the 1 from September. There are 10 packets that are pending with the court. 3 additional children were free for adoption in October, and we have 8 packets that are near completion, and once finalized, will be filed with the court. The agency continues to have difficulty providing the number of hours required for court-ordered supervision without increased reliance on our partner agencies. As you can see, we have 190 cases where supervised visitation is provided. That's up from 183 from September. There were a total of 689 visits completed for the month of October, which is 92 more than September. And a total of 1,058 hours were provided for supervised visitation, which is 187 more hours than the month of September. We do have a new homemaker who started last week. The homemaker position provides some of the supervision for the supervised visitation services. She's in the process of being trained. Interviews for the other homemaker position that's vacant is being are being completed and will continue until that position is filled. So this will allow the agency to pick up, say 50 to 60 hours of this visitation that is currently being provided by either advocate program or Fostering Futures. However, the visitation provided by Fostering Futures is part of the agreement that we have for youth placed in Fostering Futures foster homes. So moving on to page 6, our homeless placements, we did see an increase from 34 individuals to 61 unique individuals. This is likely due to the cold weather setting in. Just a reminder, code blue is for less than 32 degrees for 2 hours. Based out of Messina, I believe is where they record the weather. And the agency receives 100% reimbursement for any individual placed under code blue. A position update. We have a new foster care preventive caseworker starting on the 29th of November. As of today, we have 3 vacant child protective services positions and an additional 2 staff in child protective services that are out on leave or medical. As of Friday, in foster care preventive, we had 1 resignation and 1 additional vacancy, with 1 on leave as well. Each individual that's on the current caseworker list has been interviewed. The agency has had to start hiring provisionally. One thing that we noted that's different from previous interviews that we have done is that we have had upwards of 6 individuals either withdraw or decline the position once interviewed and offered. So that's something different that we're noticing upon interviews this time. We do have 3 in the current training pod that will be completing training between November and January. And in regards to child support, the St. Lawrence County Department of Social Services Child Support Unit continues to collect approximately $1 million a month in support payments for residents of the county. And a challenge that the unit is currently facing is that they have recently filled 2 child support investigators, and those will both be starting in the next 3 weeks, so moving them through training. The positions help to locate parents, verify income, and complete the legal process for residents in need of the child support collection unit assistance. And that concludes my part of the data.
Mr. Forsythe, and then Mr. Akers.
Heather, you mentioned 6 had dropped out after interviews. Was there, what did you attribute it? Any idea what the consensus was?
It's mixed. 1 individual, they were actually making more at their current job, so that was 1. A couple of individuals may have had other offers. A couple of individuals just decided that it wasn't the job.
Anyone else? Mr. Burke.
Heather, I may have missed it, but is there a breakdown for the number of children in care that we provide versus the children's services?
You didn't miss it. It's not in here. But the last time, I think it was a month or 2 ago that I provided that data, it's almost split evenly between around 90 to 100 between both Fostering Futures in St. Lawrence County, and then the remaining youth are placed at either other agencies or residential settings.
Do we have any control over the children in institutional care? Or is that, I mean, those are the most costly placements, right?
So when a youth is identified as needing that level of care through Family First, the qualified individual has to perform an assessment on the youth in order to determine if that is the appropriate level of care. And then it has to go through the court process and be approved as well. So there are various steps that have to be completed in order for a youth to be placed in a residential or remain in a residential setting, as well as long stay reviews, they're called, for children who are placed beyond, I think it's 6 months, beyond 6 months in a residential setting, in order to make sure that they are still in the right level of care, or if they should be stepped down, or another placement should be identified for them that could better suit their needs.
Is that a court review?
So the long stay review is it's an internal review along with the Office of Children and Family Services that takes place. The state ultimately has to approve the review. And then, of course, the youth is continuing to go back to court for that continued placement in DSS custody.
Other one?
If you don't mind.
Go ahead.
Do we have any performance indicators for the contract folks? Children's home, Jefferson County, are there certain standards that we expect of them by virtue of our contract?
I do not believe there are specific performance measures with the contract, because when we entered into the contract for the home finding, and they took over all of our home finding at that time.
Yeah, I just wonder if we should have. Anyway, it's maybe something to consider.
Wow. See none. We're going to move on now. Mr. Hamilton.
Thank you, Mr. Chair. So with regards to the eligibility programs, overall, we saw those numbers remain stable, not only year over year, but month to month. There was one exception, which within the HEAP program, where we saw 930 less applications, which I'll touch on when we get a little bit more into that information. With regard to the program applications, we saw a 25% decrease in SNAP applications and approximately a similar number in temporary assistance. And that's following a spike that we typically see in September. This is just kind of returning back to normal from that spike overall. The only major change that we saw was in the DCAP program, which we saw a decrease of 50% over applications from the previous months. Essentially, that's assisting individuals with applying with SSI, SSDI, and we typically will encounter those individuals on a kind of an incidental basis. They might come in for another service, they may be working with employment or another program, and we would get that referral. So that will kind of ebb and flow throughout the year. So as far with regard to the child care assistance payments, we saw a decrease of about $20,000 from the summer months, which was as expected as students or children are returning to school. However, we do expect to see an increase overall in that program as the poverty limits going from 200 to 300%. So as far as the HEAP program, we did see 930 less applications, which we would expect to see again. The HEAP season ended in August, the extended HEAP season. So it's been, there's a lull in services. We are going to see that number again rise. In fact, to date, since we began November 1, we received and processed 2,098 HEAP applications. I also did want to mention on the child care assistance, one of the issues that program faces is a lack of providers in the county to provide child care to families.
Questions? Comments? Mr. Corson.
On the heat, you said 2,098 since it started November 1st.
Yes,
Is that, do you have like year to date as opposed to last year? Is that quite a bit higher? I'd have to.
they're approximately. We don't have that. I could.
Okay, I'd just be curious because I got. Through the roof, supposed to.
I can get you that number.
Well. Yeah.
Sure. So the Emergency Rental Assistance Program, or ERAP, has been extended through 9/30 of 2023. To date, we have from June 1st of 2021 until October 18th of 2022. There's been a total of $2.5 million paid out from that program. And there was overall, within the Medicaid program, the caseloads remain relatively stable, not only month to month, year to years. And that includes the personal care Medicaid. There was very little change year over year, from month to month.
Give me that date again for the ERAP extension.
September 30th, 2023. Yeah, so. So it looks like November of 2021 had 8,062 applications. September 2021, 9,813. And then in October of this year, it's 7,409. So it's actually a decrease, but again, we've also had a fairly mild start to the month. And we have seen a drastic increase since the cooler temperatures. Just most of our applications have been under 300 since we opened. Since it got cold, they have jumped to over 700. So that was just for 1 week. So I expect that we will see, if not, an increase in applications, at least leveling out.
Anyone else? Seeing none. Thank you very much. Moving on to the Office of the Aging, Andrea Montgomery, and the first resolution is authorizing the chair to sign the 2023 annual update plan for funding with the New York State Office for the Aging. Moved by Mr. Smithers, second by Ms. Curran.
Hey, good evening. So this is our annual resolution that we bring forward just for our plan for funding for 2023. There were no major changes in terms of cuts or anything like that.
Question, comments? Seeing none, all in favor?
Aye.
Opposed? Carried. You have additional information for me.
Yes.
Go ahead.
So this is regarding Governor Hochul's master plan on aging. Ruth asked me just to give a little bit of an update as to what this is and certainly any impacts in St. Lawrence County. So on November 4th, Governor Hochul signed an executive order establishing the New York State Master Plan on Aging. And what this does is mandating that all agencies are inclusive of aging priorities and that we collaborate together. It established the Department of Health and the New York State Office for the Aging as lead agencies to gather input from stakeholders and create a written plan of action over the course of the next 2 years. This will include a blueprint of strategies to address the challenges related to communication, coordination, caregiving, long-term financing, and innovative care. I also wanted to include a few statistics about what's to come in the, by the 2030. So New York has the fastest growing population of older residents. 51 counties in New York State, over 25% of their residents are over 60. And this, of course, includes St. Lawrence County. By 2030, there's going to be over 5.3 million New Yorkers over the age of 60. And 70% of New Yorkers over age 65 are likely to need some form of long-term care. In St. Lawrence County, by 2025, which is only 2 years away, our population is estimated to be 112,839 total, with 29,768 of those residents 60 plus. By 2040, our population is estimated to be 114,324, with 31,019 of those residents 60 plus. So as we all know, older adults want to age in place for as long as possible. However, in order for them to do this successfully, a great deal more funding on the federal and state levels needs to be allocated to aging services to keep up with the great influx in demand. I can tell you right now, we're nowhere near where we need to be to keep up with the great need that is coming. This master plan on aging will hopefully help address the funding needs for the great demand that is coming.
Question? Mr. Reagan?
Thank you, Andrea, and I'm glad to see that, your agency is being involved in an effort to make the state aware of the needs. I find it ironic in light of the fact that the state of New York has basically turned its back on the elderly in New York State, as we've seen with the first the closing of the United Helpers adult home, despite repeated efforts to get the state to recognize the need for that service here in St. Lawrence County, and then the closing of United Helpers nursing home. We've seen a dramatic drop in the number of nursing home beds in St. Lawrence County over the past decade. And the state seems to have no interest in providing that kind of care to the elderly, and families are increasingly desperate in terms of trying to find care for their family members. And the agencies that not-for-profits that are the direct caregivers are beyond frustrated because of the state's unwillingness to work with them to make it possible for families to provide the kind of care that's needed for their family members. And as your figures point out, the number of individuals who need care just keeps rising. So, I don't know, it's nice that the governor is asking to develop a master plan. I just hope that the governor reads it.
Well, Mr. Smith.
Yep. Andrea, you commented that a lot of seniors wish to stay in their home as they age. And that's nice when that can happen with help if needed. But part of the problem is there's a shortage of nursing homes for those that can't remain in their home. And there's nursing homes, I know one in Governor that used to be very handy for us, closed down. And a lot of this has to do with federal reimbursement rates for their care. So what can we do about that? If you have somebody that needs to go to the nursing home, you have to search for where there's one available. You have to be on a waiting list. They might have to move 100 miles away because there just aren't enough.
Yeah, it's certainly a very large issue in our county. Obviously, as was well stated, that there's not enough nursing home beds. And it certainly is very difficult for the client as well as their family members when they are having to be placed in other counties. We've had some clients as of late, they're in Albany. We have a gentleman that is just outside of New York City. His family obviously can't go and see him. He needed a higher level of care that we just don't have available in any of the surrounding counties. And I think you're right in terms of, the Medicaid rate. It is just too low to reimburse some of the high levels of care. So my hope with, this plan is that it will really figure out just how much money is needed for influx into our network so that we can help these folks who want to remain in home as long as possible, as well as, certainly addressing the need for the long-term care of nursing home and assisted living. The average figure they give, if you want to talk about reducing unnecessary Medicaid spending, the average home care client for our program receives about $5,000 a year in funding. And if you look at that, and that's, for their choice to remain in their home and receive the care that they need. If you look at the average nursing home cost of what it costs Medicaid is around $12,000 a month. So it's a big difference between about $5,000 a year and $12,000. So if we can look at providing, getting more home health care aides, we certainly don't have enough. The higher rates are helping to recruit more people into this very critical field where you need a special person. I mean, it's such an intimate thing to go into someone's home and care for them. And certainly that trust and rapport needs to be established. But these folks certainly need to, be making enough money to raise their families and pay their own bills. But again, it causes that trickle down effect of the prices of everything going up. So, I'm hopeful that, really looking at the amount that's going to be needed will help the money come to us for certainly aides, nursing homes and whatnot.
Mr. Burke?
I think the idea of having a plan for New York State is great. It looks like there's going to be different regional components to that. I guess I'm wondering, is there anything local, is there anything that would be able to give like a broad assessment need for not just nursing home? I mean, I think it's great to say we need more nursing home beds, but based on what, and so it would be ideal if in St. Lawrence County we had an assessment that represents our needs and then feed it into the state and say, this is what's required to serve the citizens of St. Lawrence County. I don't know of any entity to do that. Are you aware?
Sure. There's a couple places. So every 4 years, the State Office for the Aging asks us to do a needs assessment survey of all of our folks. The next one will be coming up in 2024. Although I do wonder now with this master plan on aging if there'll be one coming sooner to target those ideas and needs of what's going on in St. Lawrence County. We're also a member of the Association on Aging New York. And one of the things that they can do is pull those types of statistics as well as the New York State Office for the Aging based on the data that we enter on a daily basis. So I think probably in the next 6 months to 12 months as these committees get formed, you're going to see a lot more of that reporting become available, and I'll certainly share it with all of you.
Who keeps track of the people that have to go out of county for nursing home placement? Is there any entity that does that?
I believe it would be tracked through the Department of Health.
It'd be interesting if it's tracked by anybody. It would be interesting seeing that data so that, if we were to do a resolution or something encouraging the state to meet our needs, that we had some kind of database to do that.
I'm happy to look into that information to see if the Association on Aging or New York State Office for the Aging can pull something like that. You're welcome.
Anyone else? Mr. Leash.
Mr. Chairman. Yeah, this whole thing on the aging, on nursing homes. Yes, there are a shortage of beds. But there's also a disparity between the not-for-profit, the rules and regulations for not-for-profit organizations are different than for profit. Considerably different. And one of the other issues is staffing. A CNA. I have no idea in the world why anyone would choose to be a CNA other than it was a noble calling. They certainly wouldn't do it for the money. You can make $4 to $5 an hour more at Burger King than you can as a CNA. So this is it's a shortage of beds. It's a shortage of personnel. There's also the regulations in profit and not for profit. And they're tilted in favor of it.
Anybody else? Thank you, Andrea.
Thank you very much.
How the legislator Smithers. And he has resolutions here. The first one is urging the governor and state legislature to gradually eliminate county fiscal responsibility for preschool special education and summer school special education program. Moved by Mr. Burke, seconded by Mr. Smithers and Mr. Akers. Mr. Smithers, go right ahead.
Yeah, this comes out of NISAC again, and this is in reference to a state mandate, which of course tells us they have to do something. And they're not meeting their responsibility in funding this. They're passing more and more of the cost to the counties, and this resolution asks them to live up to their responsibility and fund this mandate.
Anybody else? Just a comment from the chair here. We've been trying to do this for years to get out from underneath this. And I think, anything to push, prod, encourage those folks in Albany to eliminate this mandate would serve the town as well. So, all those in favor? Aye. Opposed? Carries. The second one is urging the governor and state legislature to increase preschool special education administration rate for counties. Moved by Spurn, seconded by Mr. Fay. Go ahead.
This again comes out of NISAC and points out that the special ed preschool reimbursement has not increased for 20 years, whereas obviously costs have. So it's asking the governor and state legislature to, again, come up and give us more money for this.
Anyone else? Seeing none, all in favor? Aye. Opposed? Carried. Next is a resolution urging the governor and state legislature to adjust the early intervention rate structure to improve access to services for children who live in poverty and rural areas. By Mr. Burke, seconded by Ms. Curran. Mr. Smithers?
Okay, and again, this comes out of NISAC and Jolene. Maybe you have more information about this if you were there, but there's a concern that the early intervention services need to be adjusted because there's an inequitable availability for services due to a flat rate structure. So do you have any more information about that? What could be done?
I do, and I have answers to the other questions from before that all tie into this one. So, with this, the providers that provide early intervention are the same that provide preschool. So the rates for preschool that there have been increased, a 10% increase. Early interventions, they only gave a 1% increase. So if the providers have a choice, they're going to provide preschool versus early intervention. Up here, it's not as much of a thing as we just have a lack of providers, but what they're seeing in areas where providers have a choice, they don't have to travel across, say, a county to go to underserved areas where they can just stay in one area. So they're looking to make it more favorable for the early intervention providers to be able to provide those rates. Rates are set at the state level, so we lowered our rates because it was costing the county money with the rates that were originally set. So the state gives us a flat rate. We pay just under what the state's rate is to take a little bit out for billing to cover the county's cost for that. If the state increases the rates for overall rates, then we would be able to increase the rates that we pay our providers. But they were lowered because the rates that were set back whenever they were set, we lose money every time we pay a provider at the county level for those services. So they're looking to entice providers to, with increasing the rates, to provide early intervention services.
Questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next one is calling on the New York State congressional delegation to support federal legislation that exempts qualified residential treatment programs from the federal Medicaid institutions for mental disease exclusion, and for New York State to provide state-only Medicaid funding to cover any loss of federal funds until the exemption is achieved. Moved by. Mr. Perkins, seconded by Mr. Smith. Okay, Mr. Smith,
You skipped one, but we can come back to that one.
you're right, I did. I'll come back to
Okay.
that.
This again comes out of NICEAC, and it's funding for treatment programs needs a revision to enable providers to continue the programs. So just calling on the state to look at this and revise their commitment.
Questions or comments? Seeing none, all in favor? Opposed? Carried. The next resolution, I forgot, supporting fully funding the implementation of the 2019 elevated lead level mandate. Moved by Mr. Denisha, seconded by Ms. Curran. Mr. Schmidt.
Okay, and this again is a mandate from the state that's in need of funding.
Questions? Seeing none, all in favor? Opposed? Carried. Next resolution is requesting targeted state investments in programming and policies to develop and fund 4 local services to decrease the use of emergency departments for the treatment of children and youth with complex behavioral health needs. Moved by Mr. Smithers, seconded by Ms. Curran. Mr. Smithers.
Okay, and this is from New York State Mental Health Law and assigns responsibilities for treatment to local government units, which are unable to provide without additional support and funding from New York State.
Questions or comments? Seeing none, all in favor? Opposed? Carried. The last is encouraging the governor and state legislature to enact legislation to expedite the disbursement of raise the age funds to counties and community-based organizations that work with at-risk youth. Moved by Mr. Burke, seconded by Mr. Smith.
Okay, and
Mr. Smith, go ahead.
again, this is from NICEAC, and counties need state monies, as the state said that they would provide, which they're not living up to their commitment again. So this is just pointing out that they need to do that.
Questions or comments? Mr. Wilson.
I support all of these, there's no way you can't support them all, but who's gonna pay for all this? We're asking the state, and I realize they come up with new ideas, the lead screening, lowering the level. Who's gonna pay for it? Really? It's astronomical, and there we go with our elderly. We always just talk about the kids, the kids are most vulnerable, our elderly are the most vulnerable. You can't throw enough money at it in my mind, but I just don't know where you get the money. I just don't.
I agree with you. There's too many things that the state is saying that we should be doing, but if they're gonna do it, they ought to, put their money where their mouth is,
But
more or less.
they come up with all these programs. And there's none that are bad, but I keep going back to the elderly. The elderly are the ones that are taking the blunt, they work all their lives and, I think they get thrown under the bus, so. Thank you.
Well, Ms. Curran.
The only thing I would disagree with is I think the Raise the Age program has actually not been super successful. When you read the crime statistics, there's more crime now, 16, 17-year-olds. Their charges are knocked down, they're not charged as an adult. So now the gangs know that their 16 and 17-year-olds will be the people who hold the drugs, the weapons, and everything else. And then when they're busted, they're dealt with as a child. Crime has gone up since this. Personal injury due to crime has gone up since this. Overdoses have gone up since we've done this. We just had another overdose in our town today. It's just a shame to lose somebody of the caliber of person that we did. And I just feel like the federal government needs to do something about the drugs that are pouring in all over and how it's affecting our youth. It's making our parents not be present and able to parent in homes. And this Raise the Age has been I think one of the worst ideas they've ever come up with, both in cost and the fact that it's made people not responsible for their own. They do something and now they're not responsible till they're 18. When they become 18, they're gonna go to jail for 20 years for the first thing they do that they've been pussyfooting around for 2 years.
I think you hit the nail right on the head. To be honest with you. Part of the problem is the state budget. When New York State spends more money than Florida and Texas combined, there's something wrong. And I think it is baked into the way things are run in Albany, and nobody will ever convince me otherwise. Until it changes down there, and until they stop mandating this stuff, down to us, because it's exploding what is already a huge amount of budget money. We're gonna get stuck with. And I thank Terry for bringing these forward. Yeah, it might not result in anything, but it certainly brings it to mind and puts it in the forefront, at least in this room, and hopefully out there in the public, that when we get mandates, they've got to be paid for. We don't have a choice. And where do we have to go for it? Everybody knows what we have. So I thank you for bringing these forward. We'll move to the vacancy committee review with the county administrator.
Did you want to vote on that? Did we-
Beg your pardon, what is it? Another one? Oh. All in favor of the last resolution?
Aye.
Any opposed? Thank you. It's passed. Now we'll get what's this one?
I provided you with the summary update. Tonight you have public health and social services occupying vacancy. I'll have Elaine come up. She has two that fall into the create and fill category.
So the first one, it's a typo on my side of the department. The first one is not create and fill, it's just a fill. It was vacated due to a promotion. So we have the public health specialist that we are looking to fill. We are changing the position a little bit. The children and youth with special health care needs resolution that we passed last month that accepting the grant, we are now required to have a 0.5 FTE. So this position will fulfill a 0.5 FTE within our Chisholm grant, along with doing other preventative duties, either on our communicable disease and or community health assessment, community health improvement plan. So we would like this for immediate go. Questions?
Mr. Perkins.
Thank you. What happens to the position when the grant ends?
So the position currently is, it's already part of the department. We are now putting this one though into a grant, so it would go back to being department funding unless we receive additional grant funding. But this grant is an ongoing grant now, so we just accepted it for another 5 years. And we just had the increase to fully fund it, so we've been doing a 0.25 for the part of the grant, so we're just switching some people staffing around to be able to put a designated staff member to it for the grant requirements.
Mr. Schmidt.
So this is a grant that's good for 5 years, so you don't need to apply for it every year.
We have to accept it every year, but we don't have to. It's not when we apply for it, every county in the state gets it. So a lot of public health work is funded through grants instead of straight funding. So the position is an existing position, but since we have to designate somebody to be 0.5 instead of it just being a state aidable position for us with the state reimbursement, we're going to use half the position for the Chisholm grant to get reimbursed.
Well.
That's all.
So the next one is a create and fill for a communicable disease specialist. So with taking the public health specialist position and having to put a 0.5 into that, we still need somebody to do our communicable disease work. So we are looking to create a position specific to communicable diseases, especially with everything that's been happening the last few years. We have had COVID, we've had 3 imminent threats this year at the same time, which is unheard of for public health recently, but COVID, monkeypox, and polio that we are working on. So we'd like to have a designated person within the department that can focus and specialize on the communicable diseases, be a point person for all of the hospitals where they're infection control nurses to help guide other staff that are working with the underneath it. So that public health specialist, they would help to oversee them to do training for different investigations. We've seen our stomach illnesses increase as well as our sexually transmitted disease cases.
First, Mr. Smithers. Then
Joe,
Mr. Venetian.
Just curious, is this require the person to be a nurse, or what are the requirements for the job?
They could be a nurse or they could have a master's in public health, one or the other.
Mr. Venetian.
Thank you, Chair. Jolene, and I support the position, but down at the bottom, we're talking about communicable disease investigations. And one of the diseases that's noted is polio. Polio was essentially eradicated. Everyone in this room, I believe, probably had polio vaccine when they went to before they could go to school. It was everyone. There was no such polio was a thing of the past. And now we are seeing a resurgence of polio. My question, if you can tell me, what segment of the population are we seeing the increase in? Obviously, we have a great number of undocumented people coming into the country, coming across the border. Here's where it's coming from.
So there's been the one documented case of paralytic polio that was done in Rockland County. And that wasn't an unvaccinated individual. For each paralytic case, there are about approximately 250 asymptomatic individuals with polio that you can contract it from. So that's where one case of paralytic polio is cause for concern because of how many asymptomatic individuals there are, which is up here, we have a relatively good vaccination rate because of our schools. We don't have a lot of the religious schools up here that would prevent it, but we do see more and more homeschoolers. The Amish population doesn't vaccinate either. So for us, we work with the schools to make sure that they are excluding students properly that don't have any of their immunizations. Couple might slip through the cracks, but the school nurses do the best they can to get the documentation. Polio may be one of the ones that we look into providing on the farms next year. This year we started with the more important ones, you know, flu, tetanus, because those are what the farmers are, you know, if they cut themselves, they're gonna need a tetanus shot. So we wanna make sure that they're getting those. But some of the downstate counties with the wastewater surveillance that they're doing have a detectable amount of the polio virus, which means that its presence in a larger quantity. So that means that there's more people that are shedding the virus that are those asymptomatic individuals. So they're working, especially downstate. We haven't not had a lot of demand up here for increased polio, especially in the adult. But there are people that may come here from another country, or their parents, when they were a child, decided not to get them vaccinated. Or they came to New York State, maybe where they didn't require vaccination. So there are some instances where we might have to vaccinate an adult.
Well.
And next up, we have social services.
Good evening again. The first position that I have for you, we have a few on deck tonight, is a social welfare examiner. This position was vacated by a staff member who did lateral transfer elsewhere in the department to our daycare unit, so lose that person. So our social welfare examiners are needed to basically help us comply with all programs, making sure that people receive the benefits that they need. In January of 2020, social welfare examiner, in the course of the year, the caseload would be about 480 cases. It's trending over 900 now for the course of a year, so we're seeing, you know, an uptick there. We definitely need these positions to maintain our program integrity, make sure we're meeting deadlines, to make sure that people receive their benefits. The program is managed appropriately, so we're reimbursed appropriately. So I would like to push this forward to see if you would so kind of to approve it. There is a net cost of zero because this is 100% reimbursable position.
I would just add to these, this one and the next one, which are both examiners and the clerk that you'll consider, are three that we held. And you don't see those very often, particularly you don't see those with 100% funded positions. But you may recall that I shared with the board our interest in having a new supervisor, position board approved to bring back after about a decade, to be able to do an analysis. The concern was with the state starting in 2018, indicating to us they were going to take all the Medicaid cases and then they were actually doing so. It became difficult. We stopped for a period of time filling these positions and found out very quickly that those shifts back to the county required additional staff. So this analysis has been complete. We can share that with you, but we believe now the Vacancy Review Committee has considered that these are worth moving forward and filling this time. Okay.
All right, the next position that I have you is also similar, a social welfare examiner with the same responsibilities in the same unit. This position was actually vacated by the staff member taking a promotion to become an employment training counselor and move over to our employment unit. Again, this position is needed for us to make sure that people are receiving their benefits and reimbursements are made in a timely manner, we're meeting our deadlines. And again, as the other position, this is a 100% reimbursable position.
Okay.
The next position is also in our Medicaid unit. This is a senior clerk position. It was vacated by a staff member who took a position as a social welfare examiner in our Medicaid unit. So moved from senior clerk to examiner. This person really is kind of our front door to make sure that these these cases are investigated properly for eligibility, that the right people are getting the services that they need to make sure that it's done on time. They work with us for auditing medical bills for the jail, provided coverage on our spend down programs. They just are integral in a lot of the administrative work in the Medicaid unit to make sure that we're meeting these deadlines and not getting behind. So as the first two, this is also a 100% reimbursable position to Medicaid. And I would ask that you approve that we fill this position.
Questions? And moving on, the next item is one that we would request to withdraw at this meeting. We have a position that was vacated to take a movement within the department, and the individual has made a determination to return. So we don't need or require this to be filled. They have rights back to that one. So the next one up would be a caseworker in CPS.
Yes, this position in our CPS unit was vacated. The staff member actually resigned and left the department to take a job that I believe paid elsewhere at a private organization. You're all very familiar with our CPS unit. We've spoken about it quite a bit here. I think it's important that we keep these positions filled as much as possible so that we don't get ourselves back to where we were before with high caseloads and overdue investigations. We've spoken about that quite a bit here, and I didn't want to beat a dead horse, but I would ask that you consider filling this position because it is vital that we maintain the staff level now so we don't go back where we were.
Would not imagine a great objection. I did just want to remind that we're only bringing positions to you that are outside of the training pool. So remember, there's 5 on CPS, there's 5 on prevent, and above and beyond that. So if someone, for example, was in the training pool and there was a vacancy like the one you see in front of you tonight, we're asking for that to be filled, to pull someone out of the training pool when they're ready. And then that you won't see the pool vacancies come through. I sign them, Joe fills them. So I just want to remind you of that practice. We're making sure those positions continue to move through, but that you still approve those positions not in the training pool outside of a year.
Mr. Forsythe.
The downside to that though is this individual has been here 2 years, is fully trained, probably full.
50 cases.
Yeah.
And, the only thing I would add to that is, the trend that we're seeing, I think in the standard cross employment right now is the average is 4.2 years. So I would argue in this situation, they're well on their way to being a competent, capable caseworker and moving on to either do other things or hopefully somewhere else in the department. Any other questions on CPS? We'll go on next to keyboard specialist in children's services.
This position was vacated by a staff member who stayed with the department, decided to take a job in a visitation unit. So we're at least for the most part, we're maintaining our trained people and moving around positions as they come up. So this position does handles the clerical duties for our preventive and foster care side of the house. They provide support to 5 different caseworkers and a supervisor. They work on our documentation, our placement documentation. Again, a lot of the issues that we discussed, Montedio audit in terms of maintaining those tracking documents and stuff are done by this particular position as keyboard specialist. As I stated with the CPS position, I don't want us to backslide at all. And I think it's important to keep this position filled so we don't start falling behind in our documentation. We've made great strides moving forward. I would like to maintain the momentum. So I'd ask that you authorize this position.
Questions? Okay, then on to create and fill, assistant county supervisor.
Yes, this is a new position. This is a create and fill. As we've kind of made this journey through trying to fill our accounting supervisor position, we had it temporarily filled with a staff member who, for a variety of reasons, used her rights to move back to her old position, and the position became vacant again. We determined that the position is actually larger than one person really should be handling. It would be great to have that assistant position there. Many other departments, most other departments have that assistant supervisor. It would also allow us to maintain a succession plan so that we don't end up in a position in the future where if somebody leaves, we are without an accounting supervisor. The accounting supervisor is vital to get right, with a $66 million budget and $34 million of revenue. And I was at a conference with other commissioners a couple of days ago, and I heard it. The way they described finance for DSS was that in most departments, non-DSS departments, they have a funding source comes in and it strikes at their umbrella and it cascades into the appropriate buckets. DSS is like having 12 different umbrellas that are spinning on a carousel, and we're still trying to make sure that that funding goes to the right buckets so that we can get the right reimbursements and make sure that things are done in a timely and organized manner, so that we can maximize the taxpayer dollar. So with all of that in mind, I think it is vital that we get this position right. This one and the other one that I'm going to bring forth in a moment is the supervisory position. And I would ask that you approve the creation of this position.
Questions?
Mr. Forsythe.
On a scale of 1 to 10, 10 being the best, how many of those balls do you think go in the buckets?
Right now, I think we're doing pretty good. I think we're running about 8. I think when we get the right people in there, we'll be at about 9, 9.5.
Okay.
You know, and the goal obviously being 10.
Sure.
Any other questions on this one?
Mr. Reagan.
I just want to commend you for doing this. I think one of the big weaknesses of county government has always been a lack of staff in the accounting end in various departments. And you know, I've watched county government for 40 years, and every so many years, there's a huge scandal with, because you just don't have the people with the expertise in the accounting department to keep track of what's going on with the money. And I've always felt that the county needs to invest in its accounting end, so that up-to-date information's available and they keep track of exactly what you're talking about. Thank you.
Thank you, sir. Then we have the fiscal position. So the last position is abolish and create. So sometime back prior to our the vacancy in the accounting supervisor position, it was actually a fiscal management position. The position was changed to an accounting supervisor position. And what we're finding is that the accounting supervisor position does not allow, it's not allowing us to attract the wider base of people with the municipal finance experience that we need. I think it's vital to get this position right. As I explained a minute ago, talking about the assistant supervisor position, there are so many different funding sources. There are so many different things that this position is responsible for. So the people out there with the municipal finance experience are few and far between, and to be able to attract them to St. Lawrence County, we have to have the right position with the right title, the right salary structure. So I asked Ms. Doyle if we could switch this position back to fiscal manager, which it was about a year ago, in an effort to try and make sure we get this right this time. The last thing we need is a prolonged vacancy in our accounting supervisor position. You know, unfortunately, this happened. We're getting budget time this year, and I don't want to see that happen again. I'd like us to be able to get the best and the brightest where we need to have it. So I would ask that you allow us to abolish the existing accounting supervisor position and create this as a fiscal manager.
Mr. Reagan.
What are the qualifications for this position?
I don't have the job spec in front of me, sir. I can get that for you. I don't want to misspeak and give you the wrong information.
When we do these vacancy authorization forms, can we add a line on what the basic qualifications are for these positions, so that we get a feel for what it is we're you know, for example, you know, someone who's overseeing a how much is the social services department budget?
73 million.
73 million. And, you know, I wonder sometimes, what, for most organizations, someone overseeing a $73 million budget, is required to have a certain level of educational background. And, I'm not sure that St. Lawrence County, requires that. And then, as I've said, over the years, you know, periodically, suddenly, oh my God, there's a problem, and the problem is, you just don't have people in place who have the expertise and background to be overseeing the amounts of money that they're overseeing. They just sort of move up through the ranks without really having the theoretical background and the knowledge that most large organizations require their people to have. And yes, we rely heavily on the CPA firms that we deal with, but it's important for us to have people in place who have a good understanding of what's going on. So that's just my own perspective.
Mr. Forsyth.
My question's in the salary range. The assistants at 56, this is at 58. I'm trying to get the brightest and the best. Is that competitive salary for that type of?
Yes.
Doesn't sound.
So a couple of things with fiscal manager, we've got a little more mobility than we do with the assistant accounting supervisor. So the range is available to us depending on qualifications. But I would argue, and I know Renee's out there, or if she's listening, she would argue it's very low from a treasurer standpoint, to be able to get the qualifications. If I could, and the chair would oblige, I could have, if that answers your question, I could have our personnel officer speak to the quals for this position to Mr. Reagan's request. Okay, Shannon?
So it requires a bachelor's degree in accounting, business administration, or related field, and 5 years of accounting or auditing experience, or graduate a 2-year associate's degree in accounting and business administration or related field, 7 years.
I think this also, to Legislator Reagan's inquiry, I think this also gives us another chance to put it out there for folks who may be interested. They may see the press out throughout the vacancies that are sometimes written about, and that also could be part of what they put out. Other questions?
It just bachelor's with said 5 years experience.
Yeah.
An associate's with 7 years experience. It would comfort me if, you know, I knew that this was what's standard in the field. I just, you know, have to wonder, you know, someone with an associate's degree, whether they have the theoretical understanding of the, you know, generally accepted accounting practices, which I know people with their master's degrees who are constantly having to update their knowledge in order to keep up with the field. And you know, since we've started the new program where we are helping people advance their educations, you know, I just think we need to take a look at the accounting positions that we have in county government. And, I don't mean this as disrespect toward anyone holding any of those positions. But, I think that we do ourselves a disservice when we, move someone into a position where they're overseeing, $66 million and, just don't have the, educational background to, do that. So, no one has to agree with me on this. That's just my own view.
Sure.
So we talked about this in vacancy. The important part is the change in the title of fiscal manager, which gives us flexibility. As you can see, that the person leaving that position is making almost $74,000. Certainly, the education piece is important, but you can find competent people that would have those bare minimum degrees. I think Marge Barney, if you know Marge Barney, who started at Magic Waddington as a business manager, worked her way up at age 18. She can handle this budget. She's retired now. I'm a very confident person, worked up through the system. This is too big of a job for us to actually go to an accounting firm and say, hey, can you cover this? Do you have somebody that can cover this? It could be an option. But it's the title change. It gives Mr. Seaver flexibility to somebody to put up the resume. And I don't know, is there a maximum, Johnny, to this title? Is there a maximum salary?
From salary, yes.
Okay.
Not the management bands.
No. So, gives Mr. Seaver the flexibility. Certainly, he's gonna pick out the most qualified person with the experience. Could be somebody working for car dealerships that's done, fleet of dealerships. That's working with multi-million-dollar budgets, hopefully somebody that's involved in social services and stuff. Filling this position offers that flexibility for Mr. Seaver to make the best decision.
Any further questions before we conclude vacancy? Okay, thank you.
Thanks, Sharon.
Take a minute, we'll transition to similar slide for the services department. So stretch your legs for a second, but we'll get started in maybe 2 minutes. Yeah.
I have a question.
by the county administrator.
Thank you. So on your desks, you have a copy of, like you received last week, this is the operations committee slides that I reviewed with you last week. There's been a request to provide you with the one we're presenting tonight while I'm presenting, and we can work to do that for you next week. But tonight, we're going to review high level 7 departments that I want to discuss in this second of 3 review sessions. So this will include, as I did last week, a couple of slides talking about the overall county budget, and then we'll talk in more specific terms about the departments. The department heads are present and ready to answer any questions that you may have. You're certainly able to interrupt if there's a part you want clarification. We'll go through the slides, and then if you have any other questions, we're happy to answer those as well. I do want to follow up just before we flip to the first slide. Legislator Smithers asked, I believe at the evening of the tentative budget presentation, how much in our fund balance is cash and how much is in some form of receivable. And so we have that information for you this evening. Out of the audited financials of 2021, we have approximately 52.2 in cash million dollars, and $51.4 million is in some form, and that total is 103.7 million in our general fund. So I'm not speaking to the reserves associated necessarily with items in capitalized reserves or separated off in different funds. But these, it's about half and half. It's probably a good way to remember that.
So go ahead. So when you say receivables, does that mean money that the state owes us or the federal government owes us? And if so, how much of that is like way past due?
I can get that information for you.
See, that's kind of,
Sure.
I was looking for.
Like the tribal state compact funds, for
Yeah, it's
example,
like
3 years out.
overdue, yeah, overdue amounts that shows like we have that money, but we do. It's not showing up, and we hope to get it, and we're supposed to get it, but it's not
not here
really
yet.
there. Yeah.
Yeah, we can get more details for you for next week. So the first slide tonight is a breakdown in a visual method tonight that talks about the levy and the performance of the levy since 2015. And then it also speaks to the tax rate and the activity that we've also seen in that time period as well. So this year, from 22 in what's recommended for the tentative budget for 23, there's a 2.72% increase. The left-hand chart, you see approximately 2016 to 2020, 2019, it was pretty flat. In fact, in those years, the amount the budget changed total on the levy was $592,000. So we took recovery very seriously, and that's vetted out in the levy. We did not place that burden on our taxpayers. In 2020, you start to see an increase there, but it was less than 1% change during that time. And there were 2 strategies as you start to look in 2020, 2 strategies we continue to hold. Staying under the tax cap, mitigating the cost to our taxpayers, but what we started to do also to mitigate that increase was we appropriated fund balance starting in 2020. You'll remember at first, we utilized fund balance between highway funds, and the biggest appropriation we made was $1.063 million. And the smallest, I believe, was this year at $250,000. And recommended for next year out of 3 different funds is $601,000. Legislator Reagan, you have a question?
For future meetings, could we get these
Yes.
here for those of us who have a large pillar in front
Yes,
of our
and actually we
heads?
have this screen up behind us for budget, so we can do that also. Sorry about
What
that.
screen is that?
We have another screen we can bring so it's directly in front of you like I did for budget. It made it much easier for the column
Yeah.
hiring folks to see.
For those of us who our X-ray vision has failed us.
Yes, happy to.
Thank you.
And then on the right-hand side, I wanted to point out to you, there is a 9.27% decrease in the true value tax rate. or 92 cents. So starting at $8.52, we're now down in the recommendation. So far in the tentative budget is $7.60. So you can see while we stay flat for the 4 years during our recovery period, we also have started to see increase because in that longer period of time, so say 16 to 22 and now even 23, the impact of the cost of operations has increased. We also, and I'll talk about this a little further on, have increased from 789 positions to what you see this year in 864. And there's a cost to that even with reimbursement. So in that time, I think these are pretty telling about what's occurred with regard to what we're asking for the taxpayers to pay and how we try to maintain or mitigate the impact on them. Next slide. Now this has a lot going on, but it actually explains a net change in personnel of 3.81 positions. So what we're seeing here is 0.4% of our workforce is the change where we're recommending for 2023. There's a cleanup of hours, and the positions are mentioned at the bottom. This was a year we took very seriously, trying to get the hours, which equates to an FTE rather than a full position in the Board of Elections. We talked about that last time, in Community Services, in the Sheriff's Office, and in Human Resources. So there are modest changes, and in the individual departments, you have this pie chart both in your orange budget book as well as in your department summaries. You can see the total percentage, and that also is included in one of the other charts. So we adjusted the election inspector hours. We added a position in solid waste. The two changes that rely on one another are community services. We took the folks who actually work in the jail, which is a licensed mental health counselor and a psychiatric nurse practitioner, and we moved them to the Sheriff's Office budget this year. So of course that impacts FTEs. We'll also see the Sheriff's Office request reimbursement based upon the work they're doing there. They have long made practice of approving their time, all of the functions of the day-to-day operations, and we thought this was a good year to move them across with Matt changing in a number of different funding sources and make that available to the Sheriff's Office, who oversees them already. So that's a change in the FTE on both sides. You also have in the abolish, I just wanted to clarify, there's no layoffs scheduled in this budget. Because you see some abolished positions, you see county administrator, we abolished a position following a retirement. You may see that come back. That was in our buildings and grounds area. As our new superintendent gets up to speed, he's filled, I believe, 3 out of the 4 positions that were vacant when he moved into the position. He may come to you and say, this is really the gap I'm still seeing. We abolished a building electrical maintenance worker. He may come back for that. He may come back for a maintenance or custodian position. But we want to give them the authority to make those assessments, do those analysis, but take them out when they're not filled. You also see them in the reduction of the cases associated with probation. 2 probation officers that were vacant have been removed. As I mentioned, the nurse practitioner hours have also been addressed. And in solid waste, the sanitary landfill attendants were removed from the budget. You'll remember last month or maybe the month before, we added 1 position. We're going to also be adding another position in the budget for 2023. So they'll be up to a staff of 17 from 15. And certainly not unlike the Sheriff's Office, they've dealt with medical leaves, military leaves, a number of things that have drawn down their resources. And we believe it's time, and the fund is performing well enough to support another position. This one will be directed towards a recycling project at the Lisbon location. Any questions on FTEs right now? Okay, next slide. I wanted to point out, as I did with operations, if you have any pointed questions, the departments tonight are Community Services, Public Health, Veteran Services, Youth Bureau, Office for the Aging, Social Services, and Weights and Measures. Okay. Next slide. I did want to spend a little time tonight because I have appropriated some of the opioid settlement funds. And while some things are still in litigation, and while some settlements all have not yet been paid out, we are seeing some influx of revenue. You've heard from Jay, and some of these things have come in. And in some of the new programs that we have, I've chosen to appropriate $146,198 to offset the cost associated with masks. That leaves a current received amount of $503,000. And I indicated at the bottom of the slide here, there's a number of things, and we're getting more educated as we work through this, but what's provided for in the regulation is things like supporting children's services, supporting co-location programs, some things that we are already doing that could decrease county costs. So I do think there needs to be a conversation about some of those unrestricted and restricted for appropriate use type funds to be used in 2023. But I wasn't comfortable making that determination beyond allocating what would bring the MAP program in the correctional facility down to $100,000 cost on the levy for 2023. So as we had talked about, there were 3 different funding options. This was one of them. Now, the funds that you see at the top that we know of now are $2.08 million. The time frame is this year through 2038, and they are modest amounts through that time period. Some are one-time funding, some are recurring. What we do know is the restricted amount is $943,000 of that 2.08, and the unrestricted is 1.1. To date, we've received the $650,000, which leaves that $503,000 I mentioned previously, with, if the board's approving of it, 146 allocated for an approved fund or approved use, which is the MAP treatment in the correctional facility. I would like to see, as I mentioned, some of these funds used to decrease county cost because there are many influences and impacts on county operations as related to opioid use across many of our departments. But also I'd like to work with the Community Services Board, and I've talked with Representative Haggard about how that may happen with Community Services Board input to identify some programs that could be funded that would help reduce opioid use in St. Lawrence County.
Mr. Forsyth.
Just a little bit of caution. Years ago when we got the tobacco settlement money, remember?
I do.
And I screamed loud back then that they worked it into the budget. And it was one-time money, worked into the budget, and then it went away. And then all of a sudden we had that expense in there forever and ever afterwards. That's the only thing I fear with that, absolutely.
And I think part of the challenge is currently we bear the brunt of the cost, and being able to utilize these in appropriate ways will help us mitigate that cost. I've also mentioned to you on the levy and contingency, which we'll go over next week in more detail, there's over 500,000 set aside for the MAP program. So overall, while budgeted at the department level, there's $100,000 cost. There is an allocated or targeted amount that would allow, as we're seeing this program grow, what those expenses are going to look like in 2023. I don't think anyone knows.
Question. How did you get to the $146,000 figure? What went into coming up with that amount to lose?
So there are appropriated costs that we didn't budget this year because the program just started in October. So that's going to include a clinic manager, that includes nurses, that includes an additional correction officer, that includes all the medications, and we framed a budget. You can find that budget in the S47 accounts in the sheriff's office. When we had the total cost of the program, we then took a look at funds we could bring in from community services. There's 160,000 set aside for the MAP program. That's been appropriated against it. And then there's a lesser amount, about I think 55,000 set aside for a grant associated with community services. So you take those 2 revenue sources away and you're left with the cost. I wanted to bring the cost down for taxpayers. So we utilize the difference to bring that cost down to 100,000. That's the method.
Your question?
What do you figure estimate is going to be the total cost for the MAP program? Did you say 750?
No, I don't think anyone knows.
You don't know yet.
No, but we have set aside, I mean, this cost without the revenue is 461,000. And I've set aside, as I mentioned, 550. We may be back to you with additional funds, or whatever isn't used, you may choose to use on a different purpose next year.
So the opioid settlement, 943,000 is restricted. That is to be applied to programs.
That is what they have, I think, 18 pages of literature on what it's allowed to be used for. And we do fit into that in our departments. Okay. And certainly, I think this is the first, I wanted to make sure you understood how much I plan to allocate of those funds, but I think this is one of many conversations we'll have about the settlement funds to make sure they're appropriated in a way that the board's approving of.
Anyone else?
Okay, next slide. So I wanted to highlight, as I did last week, a couple of the areas of community services. As you know, we began the OTP we talked about tonight in July. So we'll make our first full round coming through July in 2023 of that program. As you heard from our Director of Community Services, it's growing beyond our expectations. So that also will be a very active conversation and has been budgeted for 2023. We hope, yet again, Legislator Burke can appreciate this, we're yet again waiting for the mobile unit to arrive. We're now looking at spring of 2023, and Oasis has also extended their approval so that we won't lose our funding, which is paid for. So that we actually did receive the final draft, I believe, of the specs on this vehicle, and we're hoping for March of 23. That then would be up and running in 2023. Evaluate service levels in our mental health. As you know, we've had tremendous challenges filling positions, and we need to have a conversation about what that looks like long-term. We need to make sure that services are provided. We've had lots of dialogue about that this year. As I mentioned to you already, we've transitioned the jail staff who are already working over there. They're going to see a few more hours associated with some of the MAT services, but they have been moved over into the sheriff's budget. So that's also a source of revenue associated with their services, which fall under forensic mental health. In public health, they continue their transition from 3 years of managing COVID and funds along with COVID to more of a community health standard and seeking accreditation efforts. You've approved some purchases this year of software that's going to help them align better. And you'll be seeing, I think, a lot of information coming forward from Jolene and her staff about moving that department back into public health work and less so as it relates to COVID. Also, you made some approvals this year, which have increased the cost of the coroner's program. You may recall that we lost our ability to utilize services in Watertown. So we were going to Broome County, we were going to Monroe County, and she brought forward, or will be bringing forward in December, some contracts for 2023 that may require travel as well as time. Many of our funeral directors are very limited in their staff, and when they go, they don't have the ability to keep their operations running. So in that time, they'll often decline because they don't have anyone else to go. So you made some adjustments this year. I think they've been well appreciated by the folks who are providing these services for us. And you may see some more conversations about that in 2023. Office for the Aging, you've heard from Andrea both this time and I believe last about the list for home delivered meals. Certainly Legislator Denisha speaks to that. Working to address the wait list of 65 as well as maintain those on home delivered meals. We're having conversations about staffing levels there and the importance of being able to maintain folks' employment. We're looking at maintaining and moving in a direction that would keep us at minimum wage in order to even think about being competitive. Lots of times folks don't do this for the money, they do it for the service they're providing. But they do have expensive gas to provide. They do have obligations that make it difficult to continue doing this when they're not making enough money. So that's an area we want to discuss. Actually, right around the time COVID hit, Andrea was conducting an assessment and evaluation of our congregate sites, and that everything was put on hold because we shut down. But they've started back up a little bit of the grab and go, so they have meals prepared. Folks do take their grab and go, and they'll sit and eat there. That helps decrease the cost associated with providing that. But we hope in 23 we'll be able to take a look at those sites, also see the shift in home delivered meal need, and be able to address that appropriately. And then also to meet the needs and offer, she has great ideas about expanding programming for seniors, which I think we've heard tonight. The emphasis and the population associated with that is a direction that she'd really like to take the department.
Mr. Ray.
So you said evaluate the congregate sites. What's the plan in terms of reopening the meal sites?
I'm going to defer. Can she see where she can come up?
So currently we do have 5 of our congregate meal sites open. They've been all open since August. So we're kind of evaluating those numbers. I have to say currently it's been low attendance. More people, I think, with COVID, they get new habits and they're doing new things. Plus we're seeing higher demand for home delivered meals. Once COVID hit and we switched everyone to home delivered meals, we were able to do that temporarily during the emergency. We realized a lot of them should have probably been on home delivered meals all along. So we do have 5 open. Obviously there's 3 that currently aren't due to staffing levels trying to meet the demand that we have. And we will be evaluating all of them in 2023 to see where we can best meet the needs, especially given our high increase of home delivered meal clients.
But if,
When you say some people should have been on home delivered meals over on the nutrition sites, what does that mean?
Sure, so to qualify for home delivered meals, you need 2 or more chronic diseases or illnesses that make you primarily homebound. So meaning they qualified, but sometimes they were opting a few times a week to go to the congregate dining. And then certainly once COVID, there's, it really did exacerbate, I think, a lot of health conditions for folks being isolated 2 years or longer and not really leaving. We've seen a lot more people who were very active prior to COVID have a lot more health issues now.
And that speaks to one of my concerns, having the counterfeit meals gives a lot of the elderly an opportunity to socialize, a reason to get up and get out and see people and reach out for help if they need it, network with others, find out what's going on in their community. In general, it's healthier for a lot of them to get together with others on as much as often as possible, and prevents bigger problems in many cases for many of them. As we evaluate and recognize that some people are saying, well, I really like having it brought to me. We should also be taking into account the need for socialization, the need for normalization, or getting people back together again and building up those communities that existed for many, many years among our elderly population.
I absolutely agree in terms of socialization and getting people out. And I think this conversation is in no mean way to say that we're not going to be looking at those options. I think what we want to do is really look at how we can meet the needs that are currently happening. I think, doing a needs assessment, a survey to say, where are we with things? Is it the lunchtime meal that is appealing or not appealing? How can we make it more enticing for people to come out for that congregate meal? Because yes, absolutely, isolation, depression, loneliness amongst our older adults is a huge concern. So I think, it's looking at how we can best meet those needs. I think one of the concerns we have is we've been open since August and we have some sites that haven't had any congregate diners. And these are sites that pre-COVID, might have had between 20 and 30 diners a day. So I think, the challenge we have is, okay, how do we reach those folks and let them know that we're available? We've put, it out into the media. We've sent letters and notices home to all, former congregate clients to have them come out and have that opportunity.
of course,
Andrew, do you survey all the participants? Is that part of it?
Yes.
So you
we
do a
do
survey
regular.
and see what they want, and
Mhm.
what they need.
Sure.
Because you mentioned earlier, 65 are still on the waiting list, I believe. So I understand the idea if there's a congregate site that only 2 or 3 are utilizing, but it's a cost. And we can shift that cost to help pick up the 65 that aren't getting served. I understand. And there's a lot of other socialization, church and different things besides that, not just your meal. But on the medical side of it, and I'm sure the deliverer would notice it also. But some of them may have had a stroke and not know it, and things like that, and people would pick up on it and it had some sort of diarrhea. So it's survey to each person, I think it's the best way.
Absolutely, we did surveys. Absolutely, we did surveys throughout, we do surveys regularly anyway as part of our state funding. We have to do annual surveys, as well as we did surveys a few months before reopening to see what were the needs and interests and what would be the safeguards people wanted, or didn't want in place. So we have all of that data for them, and I think, again, we'll go forward, I think in the new year and send out another survey to say, hey, attendance has been low, what more can we do, to help bring you in?
Okay.
Thank you.
Mr. Akers has a question.
I understand Mr. Reagan's opinion, the numbers tell you that the sites are low. Oh, and you get a deal at your home. Well, I'm gonna take the home and, contact somebody on the phone to do socialization, whatever else. So I think in fact that your distribution system may be actually hurting your tax sites. And has anybody talked to the 65 on the waiting list and said, here's your conduit site?
Yes.
Yeah, my neighbor gets the deals, doesn't stop them from going to the casino. Okay, so, it's kind of like, I still want to say it's kind of feeding the deer. But we've got people taking advantage of the system. That probably could do without, or they could make it to the congregate site. I think you're gonna have to come up with analysis about whether these congregate sites are cost. If your costs are increasing on delivering meals, that's what people prefer. And then you can figure out what's the motivation for the program. What's it balance, of course.
It is, it's a delicate balance. And certainly not anyone can just choose to be on home delivered meals. There are the qualifications, and we do have a large grab and go population. And I think that is what people kind of switch to. Our congregate diners, some of them do come back and they just do the grab and go, and they could certainly choose to stay, but I think new patterns were established. And so I think breaking those is going to be a little challenging, or certainly enticing them to come back for more than just a meal.
Any other questions for Andrea while she's up here?
Thank you.
Next slide. I have included for social services, I think that with the new commissioner coming in, with changes happening in our fiscal unit, what we elected to do with social services was essentially maintain for this year. We looked at some areas that were really in need. We looked at the impact of a settlement that happened related to foster care. We made some adjustments like that, and there were some ebb and some flow. We were able to make some reductions, but also we had some reasonably significant increases you may be seeing as you're looking through social services. But overall, the impact of that was a $1.5 million increase. And of that, I wanted to pull out that personnel piece, and that's $529,000. So that doesn't speak to the net. I certainly can come up with those figures, but that's the overall cost. The net would be a reduction based on where they work and what that percentage is associated with their position. But of that 1.5, that's the total associated with personnel. We did decrease the revenue. I know for many, many years, we've all counted on social services to bring in additional revenue, but not being certain, really wanting to get someone in place. You may see us making adjustments as we do anyway, but more so in 2023. We're comfortable taking it down rather than having a greater expectation of revenue of just under 200,000 at 187. We did appreciate a decrease in our Medicaid share of 577,000 for 2023. But we're watching that also, because as we know, we're coming into a new administration for a first full term, and that may change how Medicaid is driven. We're seeing some changes in their ADM and their guidance, and we're continuing to follow that. With the Medicaid supervisor, that's their role, is to follow these changes and be able to administer not only what's happening with those, and then hopefully feed that into the budget next year, but also be able to communicate that to staff. So those changes happen in more real time, rather than playing catch up. Our small departments, by the numbers, not by the service. Our veterans saw a modest increase of 11,000 in revenue. Of the net weights and measures did see a dramatic increase. They're well under their budgeted amount for this year. With the penalties and waivers associated with the work done, there's been an increase, and we wanted to recognize that, much like we're looking at in sales tax this year. We see those come in, we see those coming over. There should be an appreciation for reducing that county cost for the benefit of the taxpayer. Youth Bureau, we saw a modest increase in revenue associated with that grant you approved for the youth sports and education opportunity. And those increases are attached to those those revenue sources, as well as an increase associated with the increase of salaries associated with all the departments. So those are the smaller departments along with social services. Any questions on those before we move on?
Mr. Burke.
Social services, I think it's a goal, to get the number of children in care down. And I guess I would wonder, are the resources there to do that? I mean, if it were our own personal business and we could save $1 million by investing 100,000, we'd do it. And I guess that's the question I would have. Is there a targeted plan? And if there is, does this budget do the trick as far as funding it?
So on that front, I think part of the focus that you've been hearing a little bit about, but also since the completion of the agency review, is a step toward taking on more of our own foster care. And we want to continue in that direction by 23. I think that we have the resources in the homemakers that have been approved. I think getting that number down makes it more manageable anyhow. But I think you'll hear more as we go through 23, seeing those numbers come back down on the CPF side, also allow us on the foster care side to take on more. Because, and as I think Heather Rand indicated in her presentation tonight, we didn't do those services. We didn't do recruiting and we didn't do any foster care. At the time, we weren't able to. And we've been able to have our own foster care units now. And we're also working towards taking on that homemaker to be able to generate more foster homes. So I think you'll see us continue on that path and having those conversations about managing our own.
Mr. Reed.
Got a question for Adam. Adam, can you explain what kind of revenues are you got? What are the penalties and the waivers? I mean, and do we have repeat offenders? What are you guys doing out
Can you repeat the question again?
there? So on your line item, and so your revenue is increased by 46,000. So I'd like to know what consists of your revenue, what kind of services you're providing that you're getting paid for. What type of penalties are like your lion's share? You have 35,000 listed as penalties. Are those repeat offenders? And what are the waivers of 11,000? Trying to understand your department.
Okay, so a good portion of our penalties come through administration of our item pricing law. So this is the law. I think 1998 was the last time that law was revised. So a good portion of those penalties come through the administration of that. We also administer package checking throughout the year. So we're actually going into the stores and looking at declared weights on packages and determining whether or not stores are actually meeting those declared weights or if they're falling short of what they're actually declaring to the consumer that they're selling. The item pricing law has a component to it of scanner accuracy. So what we're looking at there is we're looking at things like, what is the price on the shelf versus what is the consumer actually being charged at the point of sale. And when there's a difference there's a tolerance and a threshold for failure, and those failures result in a penalty. Similarly, those increases in the waiver revenue, when stores continuously fail. So in some cases this year, we'll have some stores that have attempted to go through the waiver process from item pricing up to 6 to 9 times, depending on the source. So there are repeat offenders. And those waiver increases are due to when they have to reapply, they also have to pay that $750 waiver fee each time that they're required to reapply.
So your repeat offenders, just say it's a large grocery store or whatever, that doesn't do. They're doing my shopping, but what I do look like, okay, cost per quarter, per houses. And so within different, say it's ice cream or whatever else, when you can't go by the half gallon because the half gallon is 1.5, now. And let's try to find out what's the best value to buy an ice cream. And those comparisons are off. So sometimes they'll have it by the quart, sometimes they'll have it by something else. The same with fluid beverages, the same way. Is that a violation?
So I think it's a good thing to describe the difference between item pricing and unit pricing.
Okay.
So item pricing, when you were young, I think it's safe to say when you were young, UPC code scanners didn't exist.
Right.
So part of the business model for all stores was that they had to item price everything. So by item price, I mean ticker tape tags that would be put on the item so that when you got to the point of sale or wherever the cash register was at the time, that the consumer and the business both knew what was supposed to be charged. Now, I think 1992 UPC code scanners started to become more popular, and that's when the board had initially brought about an item pricing law, which required stores to continue to item price despite having UPC code scanners available. So that progressed through a handful of years, and I think in 1998, we had a handful of different stores that were coming to the county and basically saying, we've got 3.5 million items in the store. This is a heavy lift for us to item price all of these items. And at that point, the board of legislators elected to offer a waiver from item pricing. So unit pricing is that breakdown, and there's a section on every shelf tag where there's a requirement for a unit price breakdown of, this is the cost per unit. And that's something that we administer as well. But when I talk about item pricing, I'm talking specifically about the actual declaration of the price that's going to be charged at the point of sale.
So I'm talking about the labels in the aisle,
Yes, sir.
which is forcing me to do math because they're inconsistent in the same products. One brand may be listed by the quart, and somebody else is doing it by some other volume measurement. And
Sure.
so I thought that, say if you went into the ice cream aisle or whatever, that everything should be by the quart. Same thing with, say, soda or beer or whatever else, it would be by the ounce. And it seems to be inconsistent. It requires me to do math. Like I said, I don't shop very often, but you don't know a fruit person. But the pencils I'm looking at, where my wife just goes and just takes it off the shelf. And I'm, on the rare occasion that I do go, which drives her nuts, I'm looking at the pricing. So are they not like within the same product line or a food item? Or shouldn't they be by the same unit all the way through comparison?
So,
We're taking up all your time.
no, this is a good question. So those are things that we do administer, and those are requirements at the federal level that they provide the guidance for that. When we see inconsistencies, for instance, we've seen instances where something has a net declaration of weight, and then their unit pricing is breaking it down in fluid ounces. So we do address those as we see them. They're not something that we see often, but it's something that does occur. So we do address those things, but there's no requirement that that between different product lines, that they would break things down in a consistent fashion. As long as they're making those declarations in some way that is within the regulations of the federal requirements, there's not much we can do about that.
Right. So what it allows is for the consumer is not to be able to compare apples to apples. It's the declaration, one product line maybe with this quart or whatever, like my earlier example. So it makes it tough. It's deceiving, but they are declaring what it is per ounce or per quart or whatever else.
Yeah,
Or
it's
something.
it certainly requires consumers to be savvy as the differences between a pint and a quart, or whatever those units of measure are. That's for sure.
So these repeat offenders, what's the incentive? They're paying fine and they're not complying, so they figure the fine is less than what it costs them to comply?
That could be.
You can tell us. And so can the fines be separate for second offense and third offense? Do they elevate?
They do to some degree. So basically the penalty layout goes in different degrees. So as long as the store maintains the pricing accuracy of 98% or above, then they pass. And then as you progress below 98%, so for 97, so if you score 97, that would be a $500 penalty. A 96 would be a $750 penalty. A 95 would be a $1,000 penalty, and anything below a 95 would be $1,500. So we've seen some stores that are scoring in the low 80s, and they're getting a $1,500 penalty. Now, if there's a multiple, so if you have two concurrent inspections that fall below a 95%, then I have the authority under the law to increase that penalty to $2,000. And in a lot of cases, if you're scoring 95% or below on a renewal application, you have no ability to pass the waiver at that point. So along with that $2,000 penalty or $1,500 penalty, I'm also requiring that store to reapply for the waiver along with that $750 waiver fee.
So in a large store that's generating $100,000 a day, like a grocery store grossing. And if everything's fine except for the meat scale, that allow them to score in the high 90s that they avoid the fine. I mean, would one, like if the scale is off for weighing, like you cut up a chicken or a steak or crowds, scale is off.
Okay.
And but everything else within the store, the other million items are in compliance and they're scoring in the high 90s. They avoid the fine, but they're still allowed to sell meat as at a higher registered weight than what's actually in the product.
Sure. So that would be something that we would actually address through our package checking program. Yeah. Interestingly enough, so meat scales, anything that's weighed on a scale actually has the price built into the UPC code. So regardless of how much is in it, it's going to ring up correctly to what the label shows as a price. Sure. The question with things that are weighed over a scale is more, is that net declaration of weight actually what is present there? So in the instance that you brought up, yeah, we wouldn't necessarily see that in an item pricing scanner accuracy inspection. We would see that through package checking within the store though.
Mr. Reagan.
So in our penalty program, as far as what you're seeing in the field is you inspect these stores and you see patterns of violation. Do you have any thoughts on whether or not the current regulations, whether they be county or state mandates or mandated rules, are out of date?
Are you speaking about like our item pricing program?
You're the guy out in the field. What are you seeing?
I think if you look at other counties, you'll see a handful of different penalty schedules. So, there's not many counties that have their own local law for item pricing anymore. So, I believe it was, in the early 2000s, the state instituted a scanner accuracy law that essentially said any local item pricing or scanner accuracy law that pre-existed, we're going to allow you to continue to function with those, but going forward, scanner accuracy laws will fall under the state portion of regulation. So I think that there's maybe a dozen counties that still have an item pricing law. I'm not certain that I would say that we're out of date, but I think that we have to be, I think that we're judicious in the way that we walk that out. I think, the law was written in 1998. The penalty schedules were created in 1998. I think $2,000 in 1998 for a penalty was felt much stiffer than it is today. Not to say that that's not a big amount of money for a penalty. But, with what we're seeing, there are some stores that, how else do you explain it when we're going through our 7th, 8th, and 9th inspections, waiver applications for a store. In some cases, I don't believe that we're effective in that way. But I think that some stores have built that into their business model to be able to pay for those penalties.
And that's what I'm reaching for. That, whether or not there's some stores that are violating our intent. And just figure, hey, we'll pay the penalty and keep fleecing the consumer. I don't know what the rest of the board thinks, but I would urge you and the county administrator to take a look at the more egregious violations. And at some point, consider coming back to us with recommendations on how to better get the attention of some of these companies so that they can't, or at least the business model won't work as well if they're not in compliance with our efforts to ensure that when people buy something, they're getting what they've been told they're getting. And, I'm just one person, but, I think it's, that's my thought. Mr. Forsythe.
And those reports and fines foilable? Public record?
I don't believe that they would be.
Okay, so anyone can find out who the repeat violators are right. The other thing is, what percentage of those fines do we keep? Do we keep, if they come in for the 750, do we keep the whole 750 or do we have to disperse some to the state? What percent?
Well, this is a local law, so we don't send any of that money back to the state, and nor do we. So say we issue a penalty, which we have issued penalties for, for short weight goods.
Yeah.
Those are not things that we send any money back to the state on.
Okay. And how often, like a repeat offender, how often would you visit that establishment?
So typically we give stores about 2 weeks, to be able to give them a reasonable amount of time to be able to approach, some sort of a corrective action. What we do require of stores that have to reapply is we do send out a waiver reapplication letter along with the penalty. And then we do require them to reapply for that waiver within 5 business days from the time of receipt of the penalty.
So I can rest assured, if I buy a 30-pack of beer, I'm gonna have 30 beer. I never count, but I can rest assured they're there.
Sure you don't.
I'm not certain if we've ever done any package checking on beer. But
Well, they ought to do that. We should, yeah.
That was your answers.
Well, I would just say, if you do take this suggestion through, I asked you to include Glenn Webster, who's in the grocery business and deals with weights and measures, I believe. So to give you some insight of what's possible, I'd like to recognize Mr. Webster, if I could. Would you recognize Mr. Webster?
Mr. Webster, sure. Come on up.
We talk about building it into in bigger stores. A lot of times they're not market selling it, funded, we funded. They'll have to pay the overtime. What they make off that day's sales, more than pays should charge. It's been built for years. They're not just paying a fine for it.
Thank you.
Any other questions for Adam?
Thanks, Adam.
Any other questions on this slide? Just a couple more to get through. Next one. So this is the same chart I brought to you last week with regard to the Department for Operations. This is the services department. So the FTEs in the staff attached to this, certainly social services is our largest. There's 388 staff total that report to services. They have a combined total budget of $96 million, and that is part of the 274, not of the levy. So they represent 35% of our total budget, 35.2. And in terms of the county cost, so the departments, the 7 departments you see here, represent 85.9, 86% of our levy. And that's, as I was sharing with you last week, the FTEs in operations are 33%, and in finance next week, you'll see 25% of our staff. County cost at operations, you saw 45, as I just mentioned here, it's 85. And in finance, that's what the treasurer's office reports, so that's actually a decrease. So that's our 30%, brings you back to 100. And the total budget operations, you saw 13%. Here, like I mentioned, you see the 35%, and in finance, you see 50%. That's just a broad breakdown of the departments as they stand for 2023. I'll leave that up for a moment. Any questions?
Mr. Forsyth.
My question is to just follow up on John's, Mr. Seaver, I think wanted to respond to John's question. I could see it, wanted to respond, and I'd kind of like to hear what you.
So could we restate the question, sir?
I'll let John re-ask it, but
Yes, sir, I believe so. I think one of the things that we've been doing since I started, and I know it's been an ongoing thing even before I got here, was reassessing the staff that we have and the ways that we can utilize them in different areas. I think we are at a point now where we're going to start seeing the numbers of kids in care come down. We have the staff to do so, and I think the other item, the other piece of the puzzle that we talked about was the change in the judge. I think that since the judge changed, we're seeing a lot more kids move through to permanency. That's a trend that I think is going to continue, that we definitely are pursuing with that. And we had 6 more adoptions this month. We're doing everything we can to bump up our efforts on the front end for prevention services so that we don't end up with kids in care. And I know that the statistics this month showed that, we had a lot more kids entering in prevention than coming into care, heading towards the foster care track. So I think we're heading in the right direction. I think we have ample resources to tackle it. Again, it's something that we'll be reassessing as we go forward, but I think we're in a good place to do that. Yes, sir.
And then the last slide is just an update on our schedule. So this week is a short week. Offices, besides our 24/7 365 operations, county offices will be closed on Thursday and Friday this week. Next Monday, we'll go over the remaining departments: administrator, attorney, highway, real property, solid waste, and the treasurer's office. And then at the end of that meeting, should there not be any changes, and the finance committee is prepared, they can hand the budget up to the board of legislators to be taken into consideration for the public hearing, and then adoption on December 5th. So that's the schedule. Unless there are changes or questions, that's how we'll proceed. Okay. Just go ahead.
Yeah, county administrator.
Okay. So I'll keep this brief. I have 2 transfer of funds to share with you, along with many conversations that we're having about the increased cost. In emergency services, I have 2 to share with you. One is to address the cost of propane at our towers, which provide service there, for an additional $300. There has been a 68.9% in this budget line for 2022. Not immune, I think, any of us to the impact of these, but I wanted to share that with you, as well as the cost of garbage removal, snow plowing costs. Emergency services also moved $1,200 in their budget to cover 2023 costs. So those are the 2 transfers. I did want to advise you, because it may affect when you come to our meetings. The Village of Canton took up a public hearing last week for the prohibition of parking here on Pearl Street from November 30th to March 31st. I think they have a very difficult time. That is a narrow street of getting snow removed, depending on when it is and depending on when, we have employees that park there as well. But I want to make sure you are aware of that consideration by the village. And then just a quick update. We had our visit with the Rich Road Solar project last week. The EDF representatives were on site. Legislator Fay joined us, as well as Planning Director Jason Botenhauer. They indicated to us, I have plenty of literature if you're interested to take some with you. I'm looking to submit their application mid-December, although they indicated there may be a slight delay with that date. They'll keep us advised and make lots of notices available when they get closer to that point. That's all that I have for administrator's report, unless there's questions.
Any questions? Mr. Akers?
Earlier in your report, actually, Mr. Smithers asked about cash on hand receivables. You mentioned 52.2 million in cash. How much of that is unallocated?
15 is unallocated. 23.3 is restricted cash or cash equivalent, and 13.8 is investments.
What is our total amount for the unallocated fund balance then?
I would have to subtotal those for you, 15 and 23. The overall total, you mean less the amounts that are not in cash?
What's unallocated? We want to throw a large party. What do we got?
We have 15 million, we're not going to.
So our unallocated fund balance is 15 million. I thought.
Well, that's the cash at the close of 21. So there's also in restricted cash and cash equivalents, 23.3. And then there's also investments which may have penalties associated with any change, and that is 13.8. We could certainly go into more detail if you'd like, but I wanted to give you the broad numbers associated with that.
Any questions? County Administrator?
And I'll come back to you with the age of the receivables also next week, and bring you the slides.
We move to committee reports. Senator Akers of Board of Health.
So a lot of it's been talking about Jolene and her empire building over there at Public Health, about these different positions, well deserved. We talked a little bit about COVID, a lot about getting the lift out. So, and we've tasked Jolene with the coming up with how many actually kids that we were actually testing under the age of 4, I believe. So that's what we're concerned about. You know, you have the new standards of what qualifies as a problem for that, and we've got a lot of old homes here in St. Lawrence County across all economic stratification of incomes and stuff. So we're interested. We spent quite a bit of time, probably 30 minutes, Jolene, 40. We spent about 40 minutes talking about that. So other than that, covered the other things tonight. Once again, I'd like to praise Jolene for what she's done for the ag community.
Okay, thank you. CDP Board of Directors, Mr. Sheriff.
Thank you, Mr. Chairman. CDP Board of Directors met on November 16th. Their audit committee reported that their current ratio is 11.43%. Their open invoice report reflects $22,000. Nothing is past due. All their bills have been paid. The heat is showing a current profit of close to $15,000. And the HCVP, which is the Housing Choice Voucher Program, showing a profit of $32,000. Weatherization crew is currently working on cleaning out the warehouse. And the Head Start program continues to look for staff. And all centers have been quarterly inspected and passed inspections. And the neighborhood centers are currently preparing for the holidays, for the Thanksgiving and Christmas holidays coming up. And the economic developer is working on a work from home policy that she hopes to have ready and presented to the board come January.
Did Ms. Haggard ask anybody to present anything from community service? I guess not, so let's get that. Now, Office of the Aging Advisory Board, Mr. Ganesh.
Mr. Chair, keep it brief. We met on Monday, November 7th. Mike Mulfree, our Veterans Affairs Officer, was there, spoke about at length about the issue with Camp Lejeune in the drinking water, talked about burn fish legislation. There was some discussion around the growing number of scams that are targeting seniors. Holiday gift drive is on. Last year, over 300 gift baskets and gift cards were distributed to seniors in St. Lawrence County. Next meeting was Monday, February 6th at 10 a.m. And this is your last opportunity. Actually, it's not your last opportunity. It's another opportunity If you haven't given Andre any money yet for the holiday gift baskets, I'm sure she'd be happy to receive it this evening. Thank you.
Where you're at.
I'll go.
Youth Advisory Board, Mr. Terminelli, I see you joined us. Welcome. Are you prepared?
Thank you. So our next Youth Advisory Board meeting is on Tuesday, January 3rd at 5:30, and it will be in person. We've moved to quarterly in-person meetings. Our last meeting was in person on November 1st. This past Sunday, we had 8 of our teen ambassadors that completed the QPR training. The QPR training is a training that allows students to be able to read cues that people may be having suicidal ideations or thoughts, and then to kind of prompt conversations with them and point them in a direction towards help. The next youth committee meeting is Sunday, December 4th in person at the Youth Bureau. Monthly planning meeting will be conducted, but the teen ambassadors will be making holiday cards for the Army Brigade 368 that they have adopted. They're currently deployed overseas. Currently, the holiday card drive is underway. Those cards have often been shared in the baskets for Office for the Aging. So that information has been sent out to all of the schools across St. Lawrence County so they can contribute cards over the next couple of weeks for that. Those are due to the Youth Bureau by Monday, December 12th. Anybody is able to make cards and send them on over. And I think that that's about it.
Thank you very much. There is no need for executive session tonight. Is there a motion to adjourn?
No, old and
Old
new
business.
business.
Huh?
Old and new business.
Or to have old or new business. Is there any old or new?
Yes.
business? Go ahead.
Probably 6 weeks ago, Ruth and I discussed the MAT program that they were starting up at the jail. On Friday, Ruth and I toured the jail. We saw the MAT program in progress, what was going on. We spoke with the attending physician that is in charge of it over there and the nurses that have been hired. It's really going, I think, quite smoothly. They have really good guidelines on who gets it, they used part of the jail that was already there to administer it. It's very controlled. There's no issues that they had told us about. And so they were happy with the way it's running. We didn't get any complaints from anybody while they were over there. And right now, 37.6% of our inmates are getting it. If anybody has any more questions, I'd really go over. Brooks will take you around and show you how it's done.
Go ahead, John.
It's the Suboxone. No, that's just at the jail. It's just the Suboxone tablets. They actually grind them up in a grinder. Everybody comes into the visiting area. They have their seat. No, well, there's one person that is getting methadone. That part is new, but out of the 37.6%, there's one methadone person. And they're still setting up guidelines for that because, you know, what do you do if somebody's still fentanyl positive in their urine? You're not gonna give them methadone.
The other or seeing none. Motion to adjourn. Second by Mr. Smithers, Mr. Brown, all in favor? Aye. Opposed, carried, adjourned. Thank you for showing up.